Welcome. I am super excited to have you join me on this webinar where I love to share information about dental implants. But a little secret is that it actually isn't so much about dental implants as it is about solving real problems like having pain in your mouth, not being able to smile because you're missing teeth, not being able to chew because you're missing teeth. Having things that really do affect your life, your function, and your confidence, which I think is huge, your health, which I think is even more huge. I think that those two things go hand in hand to make us feel more happy and find more joy in life. When we can have confidence, we can be pain-free, and we can smile and of course stay healthy by being able to chew and function with the healthy food. So that's really what this is all about. It's to solve those kind of problems. And so I wanted to go through and share some of my ideas around that. Again, my name is Dr. Guy Gross, and I've been practicing, dental implantology and general dentistry for almost 18 years in Salina, Kansas. I was doing training years before that. I'm thrilled to be here where I can use the things that I've learned over all those years to help teach people. Not only I get a chance to teach other doctors how to do dental implants, but in the process of that, it helps me learn so much about how to solve problems for people, real patients that are in the real world, just trying to live life and be happy. And quite frankly, they don't want to have to think about their teeth. They just want them to do what they're supposed to do. It's like having a computer that's supposed to just work, and when it doesn't is the only time you realize, that's not cool. So what I want to be able to do is help you get through the process of understanding some solutions. And so I wanted to start just a little bit and tell you about my practice. My practice, the main practice that I work out of is here in Salina, Kansas. And I feel blessed. I have a wonderful facility with an amazing team around me. Inside of this facility, we have a tremendous team. They were recently named the National Team of the Year, and they have been wonderful at serving patients. I hope you'll find that when you enter our office that you'll find that people that have a spirit to serve and just love to take care of people. Inside of that building, we have 4 doctors who provide every kind of dentistry that you could imagine. We really try to serve patients of all ages and all dental needs. So whether it's dental implants, of course, or orthodontics, taking care of pediatric dentistry for kids, all the things that you hear about, like root canals, crowns, fillings, of course, cleanings, and anything that's related to the health of the gums. We do all of that under one roof. In addition to that, we've been able to, teach dentists from all over the world, really, inside of our facility, where doctors come in, they spend time with me in our basement lecture room where I spend time teaching them. And in addition to that, I go in the clinic and I actually will demonstrate for them on real patients, how we take care of patients, how we serve people, and of course, how we can do procedures that solve patients' real problems. And so it brings me tons of joy to be able to do that. I love teaching, and I love that it makes me a better practitioner and a better clinician every time that I do teach. So right here in Salina, Kansas, we're able to do that, and I'm thrilled that has been the case. So just know that we have not only the facilities, but we have the people that can support you through the journey that you may be about to embark on. All right, I wanted to mention that, if you are wanting to digest more of the information from the slides, definitely use the downloadable PDF and print that out, and you can take notes along there if that helps you. But if you just want to follow along and just listen, that's totally cool with me. I want you to know that, the things that I have right now is that we're really working to solve real world problems, the things that really affect people's lives, the smiles, the chewing, the function, and all of that. And so when people have missing, broken, or loose teeth, it really just creates tremendous problems in their life. And, we want to be able to find solutions to that so that people can improve, where they're at. So it starts with kind of understanding your options. And one of the things that I always think is really, really important is to let people know that, doing nothing is always an option. you don't have to do anything. I'm not here to tell you, and I'm never here to tell people what they have to do in their life. But in the world of dentistry, understanding what your options really are is important. I do want to side note that doing nothing tends to always cost more in the long run. Yet some people have had their teeth removed already and don't even wear dentures. So doing nothing for them may mean that they just stay how they are, and they make sure that they have a good blender or whatever it is so that they can get nutrition. And then they go on about life the best way they possibly can. Some of the options that have been around, people have heard of these all the time, is removable dentures. And in a traditional sense, removable dentures really, have become an outdated technology. Acrylic that's formed to your mouth but really doesn't attach to anything, that can float and move. To me, that has become something that it is a step in the right direction, but it gives people about maybe 20 to 30% of their original function back. It is not what I would consider to be even standard of care anymore. It is just one of our options. So I want you to know that removable dentures do still serve a purpose in my practice. It's very rare that we don't do them with some combination. And so dental implants, of course, can work in so many different ways. We could use dental implants to rebuild each individual tooth, or we can use dental implants in combination with different types of prosthetics, such as dentures, to where we can make it so instead of having a floating acrylic, you actually have the ability to hold those in place and make them so that total confidence that things aren't going to slip, fall, move around. You can chew, you can smile, you can laugh, you can sneeze, all those things, and your teeth don't move around on you. So what the initial message I want to send is that implants can be used in so many different ways, and in many ways they're used as an enhancement of technologies that we've used in the past that maybe have evolved or are being to some extent discontinued. So it's really important for me to share that dental implants aren't all just about holding teeth in place. They also are about retaining bone structure. So I'm going to show you a quick video here, and I want you in particular to watch the yellow part. That's the bone that supports the teeth. Once the teeth are gone, that yellow bone, that's what we call the alveolar bone, that goes away, and you start to see what happens is people, as they chew, their chin and their nose start to come very close together. I hope you can see that very well on the slide there, but it's just a diagram to kind of understand that one of the huge hidden values inside of dental implants is that it keeps bones stimulated so that it doesn't resorb and go away. And I'll take that a step further and show you why that matters. Bone structure and teeth support soft tissue. And so you can see in the area on the left side of the screen that the patient that has full set of teeth and full bone structure actually has full facial features, and their soft tissue is well supported. As they lose their teeth, you can start to see that the soft tissue is much less supported. Then if the bone isn't preserved, the bone starts to go away too, and you can see on the very far side, the right side of the screen, what happens when the bone is severely resorbed and the soft tissue is much less supported. And so, on the left side of the screen, if that patient were to just lose 1 or 2 or 3 or 4 teeth, we could easily replace that with individual dental implants and get them right back to where their bone structure is retained and their soft tissue is supported, and you would never know that they ever were even missing teeth. The patient in the middle is more symptomatic of somebody who gets their initial set of dentures. And that person, because the denture can have a saddle effect on that amount of bone, the denture doesn't move around so much, and so they're generally okay. They might be only at 30% function from their original, but they adapt and can start to get used to it. As they continue to lose bone structure, though, their dentures become looser and looser, their face changes, and they get to a point where they become almost dentally crippled and are unable to get, hardly any solutions in their mouth. We're down to where we actually, only have the very lower anterior of their jaw that we could use where we could place implants to stabilize out a denture. The patient in the middle, we could probably place implants just about anywhere, rebuild teeth, and get them back to original function or very close to. I would say we could easily get them back to 80-90% of their original function. But that patient in the middle, like I said, they're generally happy with their dentures. When they have to get a new one, they feel like their original denture was okay. And then the patient on the very far left, you'll find that, or on the very far right of the screen, you'll find that they don't feel like their dentist makes a good denture anymore. It's like they said that my original denture fit fine, and then now I've got this one, it's loose. But as you can see, they literally have no bone structure. Think of it being like flat with the floor of their mouth. So there's no saddle effect. The denture is just sort of floating in there. Their tongue, their lips, their cheeks are moving, and they really struggle. So that to me is something that, highlights why it's so important to not only, help them retain their ability to chew and smile, but retain their bones so that in the course of their life, they don't become dentally crippled by their situation. So that is a really, really important thing to me. When patients, get to the point where they're wearing these dentures that are loose and ill-fitting, a lot of times they show up in my office with their dentures. For the men, it's in their pockets. For the women, it's in their purse, and they're not even wearing them. And it's like, if you asked a kindergartner, what are teeth for? They would tell you they're for smiling and for chewing. And when you get to a point where a patient's taking their teeth out to eat even because it's so uncomfortable, or when they can't smile anymore, that to me tells me that something has to change and that we can do better for them. And so if you find yourself struggling where it's more comfortable to have your teeth out of your mouth than in your mouth, we can help you. That's where I really want to, have you, find these solutions. So as we go through the rest of this webinar, we're going to work to find those solutions for you and start to identify specifically what it is that can help you. In addition, we'll highlight ways that you can access us, whether it's through a virtual consult where you can get me virtually at any time, any day, or you can come see me in person. And I have some special gifts for you at the completion of this so that you'll find ways that you can access that information more in person. So certainly dental implants play a big role in what I'm trying to do for people. But again, it's not necessarily all about that. It's about finding solutions. So, to get down to a little bit of science, people ask, what is a dental implant? Well, it really is, it's a titanium. It's a type 5 surgical grade titanium that once placed in where it basically mimics the root of the tooth, and your bone essentially fuses to it and creates like a new root of a tooth. And then on top of that implant, so the silver part on the bottom is really the new root of the tooth. That is the dental implant. And then the prosthetic parts of the tooth are the parts on top. So we want that to be able to be something that will last for life. If you take care of that, if you get an individual tooth rebuilt, we see it that it can last you a lifetime. You might wear out the tooth on top, but we would hope that you would never wear out your new root of that tooth, and we can always just replace that top part. So if you brush them, you clean them, you take care of them, they really will last a very long time. I want to share with you the way the different parts of implants and their associated prosthetics work. On the left side of the screen, you're going to see an example of what we call fixed prosthetics. In other words, a tooth that stays put, not something that a patient could take out. On the right side of the screen is going to be where we have removable prosthetics, where a patient can take them out on their own. And each one of those has different parts and components, which is why, this is a common area of confusion with patients, is that, they don't necessarily, it's like an implant is an implant, but actually we use implants in so many different ways. So the second piece that becomes the connector that attaches into the implant is called an abutment. And that abutment really connects from that root of the tooth that we created up to the actual teeth that you chew with. And so on the left side, again, we have abutments for fixed prosthetics. On the right side is for removable. And what you'll see is let's say we're replacing just a single tooth, we're going to place an implant and an abutment and then a crown on that implant. And so when you look in their mouth, they're going to have a new tooth there, just one tooth in that space, or maybe it's a couple teeth that are like that. On the right side, it's more for an option where people are missing a lot of teeth, and we want it to be a removable solution where the implant solution can cost a little bit less. So you'll see what we call abutments that are made for denture retention, and inside of the denture, embedded in the acrylic on that right side, would be a housing that would connect to those abutments. And that would be where the patient could then put those in. They click into place instead of putting their dentures in where they can be left to float around. They're actually going to click into place. So, chewing apples, biting into those steaks, all that sort of thing is right back in the mix for these patients in a way. And it's one of our ways that we can replace a lot of teeth affordably with dental implants. So I wanted to share, that the metal in these implants and the technology is very similar to that where you see joint replacement. So the picture on the left is a hip replacement. And, obviously this is not drawn to scale because a hip is much bigger than a dental implant. Dental implants are just little guys. But in that hip joint, that metal goes down in there. It's actually glued into place. So those patients can get up and start walking as soon as the glue's set, same day, next day, whatever it is. Where with dental implants, we don't use glue in the mouth. So we actually let your body build the glue. It's like setting the concrete around a fence post. So usually that takes a few months for that osseointegration to occur, and then the patient is ready to get their tooth built. So it's not same day in all cases. There are ways that we get people teeth same day, but we don't necessarily always do it on the implants because maybe the bone and the implant isn't ready for that right away. So I wanted you to be aware of that. Certainly, I want you to know that you're not alone if you're, getting dental implants. There are actually, I just saw that the stat said 5 million implants per year being placed in the US now. Just a few years ago it was 2 million, but it's a growing thing. It's the most common gold standard in dentistry for tooth replacement therapy. It's still an area where not a lot of dentists know about it. That's part of my mission in teaching them. I shouldn't say that they don't know about it. They maybe don't know how to do the surgical aspect of it. So, it is an area where I try to help them learn at the courses that I teach. But for you as a patient, don't think it's certainly not something where you're being experimented on. It's certainly not something where, the technology is not proven, because it really is. So in addition to knowing that you're not being experimented on, the other thing is to know that you're not alone. You don't have to feel shame about the fact that you've, lost teeth or something like that. Certainly it's important to know that, 7 out of 10 people by the age of 44 have lost one of the teeth that they aren't supposed to lose. And I think that that's, telling in that, sometimes our bodies just break down on us, whatever happens, so you're not alone. It is certainly something that we can solve for you. And, the other thing is that to me is even more scary is that over 1 in 4 adults by the time they're age 74 have lost all of their teeth. That's something that in my career I'm committed to helping change. But I see that, that has occurred. And in the past, it seems so common that people would just, dentists would recommend patients just get their teeth out if they had a bunch of cavities, And so I've known patients that got their teeth out when they were in their teens and 20s. And that's just scary to me. I would like, if I could, the earlier I could catch these problems and solve them, the better. And certainly, the other thing is to know that when we go through this process, we're going to work to make temporary, teeth if we need to, whether the implants are ready to be utilized or not. You're going to have your smile back. You can have it back almost immediately. And that's a common question because people want to know, am I going to have to go without these teeth for 3 months or 6 months or however long? And what my goal is to make it so that it's our little secret. Nobody really knows that even has occurred. So we want to help make this process as easy for you as it can possibly be. And so when we do that planning, that's one of the things that we do at the consults. When you come see me, whether you come see me in person, ultimately, if you're going to get something done, you've got to come see me in person because you're probably already starting to get the idea that each patient really has their own plan because one, we don't know we don't know what their anatomy looks like until we've seen it. We don't know what their bone structure, their soft tissue, or even what they want, whether they want teeth, they're okay with them being removable, whether they want teeth that stay put. We don't know that until I talk to you. And the third thing is we don't know what your budget is, because there's a lot of different options. We have our options that we try our best to make on the most economical side possible. And then we have the premium options where maybe a patient gets a lot of implants and replaces all their teeth, and they don't want anything that's removable. Those get to be the more premium options. So just know, in those consultations, whether we do it virtually or in person, we're going to start to get you those answers, and certainly try to get you the answers about the costs as well. So it starts with us getting to know you first, and then we can really make plans from there. One of the things that I think is really important to understand is that there are differences in how you can approach doing the surgical work of dental implants. And in the way that I was initially taught, the way that most surgeons are still doing it, it's a very invasive procedure, which to me makes implants very scary. It makes things more painful. It makes it take longer. And so you're seeing things like where patients need stitches and incisions, they have a lot of postoperative discomfort. They're having to come for a lot of postoperative appointments, and they take a lot longer to heal. The more invasive a surgery is, the more people take to heal. What I try to do is endeavor to be on the side of minimally invasive, where we can do implants in just a few minutes, where patients have no incisions and no stitches, and where their healing time is much shorter. That's the goal every time I do dental implant work for patients. And I think of it as comparing, this type of surgery where it's a microsurgical approach that I use to, in the past, if you had to have a surgery on your abdomen, you would go in there, they would cut through all your layers of tissue, open up, do the surgery, stitch you all back, and you'd be in the hospital for 1 or 2 weeks. And nowadays they do most of those procedures laparoscopically, where you're out of the hospital the next day, sometimes same day. I like to do dental implants where patients can go back to work as if nothing ever happened the same day quite often. And so, there's different levels. If people have really infected teeth that need to be removed and they've got a lot of surgical work, it gets more cumbersome, but for most implants that we do, we can do it very minimally invasive. And that, believe it or not, that actually lowers the cost of dental implants. And it certainly lowers the cost of all the extra appointments, the time off from work, and the time that you're missing that functionality. So to me, those are big things. It all adds up. And my endeavor is to get you back functioning as quickly as possible for the best, most economical way possible that serves you and what you want and what you need. Before I continue, one of the big things I want to share with you, you've probably been seeing some buttons on the bottom of the screen that kind of allow you to connect to us in different ways. One is certainly you can reach me by coming in for a complimentary consultation. So one of the gifts that I have for you, and just for being part of this, is I'm happy to share some time with you to help you find the solutions that you need. In addition to the consultation, I'll also do a 3D scan for you, and you'll see that there's a special offer on your first dental implant. So you have an opportunity to take advantage of those gifts as something that you'll see at the end of this, for being part of this. And I know that when you have more understanding of this, that it's easy for you to make decisions. And so, we can work more synergistically together like that. If you can't make it in to see me right away, another option is to click on the link for the virtual consult, where you can reach me and I can do a consultation for you, and it'll be specifically tailored to you so that you can get some information before you ever even meet me in person. So just know there's a lot of ways to get to me, and I'm happy to make it so that access is easier to get the answers you need. So I was talking about minimally invasive implants and how I'm passionate about microsurgical techniques, and part of the ways that I do that is through the use of 3D scanning technology. So I mentioned that it's a complementary piece of this puzzle. 3D scanning technology has changed the game so much in what I do. Yet I bet 98, 99% of all dentists still don't have it, don't use it. And to me, it is mission critical because when I do, well, I'll give you an example. When I do consults for people and I have their 3D scan, I can actually look at their bone structure. It's almost like you kind of get to watch me play video games, but I get to do the surgery first on the computer. I know exactly what's going on. It used to be that we had to remove the soft tissue to place implants and then stitch it all back together. Now, most of the time, I know what's underneath, which is what allows me to do microsurgical work. And so to me, that is the answer to helping people have implants where it doesn't even hardly change their life. And once they get the teeth, of course it does, but they're not laid up in a hospital bed. They're not laying at home in misery, things like that. They actually do really well. Most of my patients go back to work the same day. And I attribute this technology in large part to being able to do that for patients. So I find that to be such an amazing gift that I can offer, and I'm happy to do that for you. Let's get into what dental implants actually do and what your options are so that you know more about how we solve these problems. So if a patient comes to me with just one missing tooth, we can do an implant, an abutment, and a crown, and they'll have a new tooth there as if it was never missing. Okay. If they're missing a segment of teeth, there's two options in this scenario. So you'll see in the middle picture, there's two implants there with abutments on them. And then in between the teeth is connected what we call a pontic. So that's a bridge across from implant to implant. The other option is that we could put 3 implants in that space and build 3 individual teeth. So it'd be just like 3 of what you see in the very left-hand picture. Now, if a patient was missing even more teeth but wanted all their teeth to stay put, they didn't want to ever have to take their teeth out, we could place more implants, and typically we'll place like 5 or 6 around their entire arch and then do a fixed bridge all the way around so they never have to have their teeth come in and out of their mouth. That is a more premium option. It's something that a lot of our patients choose because they don't want removable body parts. And so that's an option for you, just to know that we can do things in multiple ways for you. The additional option, and I mentioned this earlier though, is to usually we'll place like just 4 implants, and we will do housings inside embedded into the acrylic of the denture that connect to those implants so they put their denture in and it stays put. That's an example of a removable option. And so the left 2 pictures show fixed options where teeth stay put. If you're missing a lot of teeth with the fixed options, it requires more implants to solve it. So those are a little more premium options. And the secure denture option on the right-hand side is something that is more of an economical way to replace all of your teeth and still get the functionality very close to natural teeth. So that is, in essence, the way that we serve patients with them. So I wanted to show you a couple of actual procedures that we did. Here's a patient that was just missing 1 tooth. And so he came in with a broken tooth that had been in an accident. You can see on the lower right-hand corner that the new tooth is back in place, and that is a dental implant. And it is, you can also see the patient went ahead and had us fix up his other teeth around that. But still, if you didn't see a big yellow arrow pointing at that, you wouldn't even know that that was a dental implant, like that it had ever been missing. So, I'm really proud of those kinds of cases where I can rebuild something and it looks natural, it functions natural. Again, it's my little secret when it comes to that patient. Nobody knows but he and I, and that's the way he probably prefers to keep it. When it comes to the fixed implant bridge, here's a patient that was missing their front 4 teeth. And again, while we were in that integration phase, we made him a temporary set of teeth so he never went without teeth. But what we did is we placed an implant on each end of the empty space and then attached, a bridge across there. So again, if you met Mike, you would never even know that he had teeth replaced. It looks like natural teeth. He's back in business. And again, our little secret. Okay. So another option, which I think is really cool, I think you need to look at this as a patient that's gone through a process of having a really painful transition of having teeth that were infected, teeth that were hurting, teeth that didn't look good anymore, and certainly affected her confidence. So I want you just to kind of see not only the way the outcome looks, but the way that it had changed the entire countenance of her disposition towards the world. So here's the before and here's the after. And I want you to see that, while we chose those denture options that are removable, but they attach, you would never know that by looking at her. She smiles bright. She's gotten rid of the glasses. She's changed her hair. She's done a lot of different things, even with the way she does her makeup. And, she was able to choose that smile design based on how it fit her face. She actually was able to test drive that. So every time I do a denture, a patient gets an opportunity for a customized smile design. They get a chance to see what it's going to look like before it's finalized. So we try it in a prototype phase. They get a chance to choose the color, the shape, the size, the way it bites, all of that. We make it all fit them so that they feel very comfortable and natural. And so in her case, she chose a nice bright solution and her teeth look healthy and vibrant, and she's super happy with that. Some people may want something different. You get the chance to choose. It isn't where I just give you teeth and say, take it or leave it. You actually get a chance to be part of that design process. So I'm really excited to be able to do that for people. I mentioned earlier that, as you come in and see me, my mission is really going to be to help you gain confidence. It's going to be able to help you stay where you can smile without feeling like something's missing. And it's also going to be where you get to stay healthy by eating the foods that you enjoy. I find that loss of health through inadequate nutrition is one of the worst things that can happen to people as they age. We do a lot of service to people in nursing homes, and we find that their malnutrition is their number one cause of early death in the nursing homes. So our job is to help keep people with their teeth functioning well. And I find the more people have stayed ahead of that, the more they've taken measures to ensure their health before they get to that stage of life, the better they do. So I see my job as not only solving the problem today, but helping you have a plan so that you are set to go, so that no matter what, turns come in life, you are set up for success and not going to get malnourished by having teeth that don't work. And also, not going to be at a point where you're having to lack confidence. You quit going out socially because, you're struggling to have teeth that are either gaps or loose or whatever. And, I find that some of the healthiest foods that we eat are the ones that are hardest to chew. And for me, whenever I talk to patients, it's things like steaks, it's corn on the cob, it's carrots, it's apples, it's nuts. Those are the things that they really struggle to chew. And if we can get those things back into their life, they can stay healthy longer by getting the vitamins, minerals, and the proteins that they need. And to me, that's mission critical. I wanted to take just a few minutes to share with you what patients are saying so that you can kind of understand real people are actually getting this done and that they're doing well and functioning well. And so one of the things that's very easy access for you is to certainly go on to our Google reviews and read. There's a lot of times where, you can get I could tell you that you could get an implant pain-free, but you could actually read real people saying that they got their implants pain-free, and that's something that's really important to me. On the slide that I'm showing, you're seeing a patient that had her very front two teeth replaced. It's the most tender spot in the mouth, and Esther's talking about how I had no pain. The patient above, is talking about no pain. I love that. That's like, music to my ears when patients are able to get dental work done and not be in pain, because I know that dentistry is commonly associated with that it is painful. I don't want that to be the case in my practice, and I'm doing surgery all the time. And I think, it's almost magical if we can do surgeries without it ending up putting patients in a bad spot. So check out our Google reviews. That's something you can definitely see. I also want to share with you what my friend, he's now my friend Paul, had to say. And he texted me this video one evening, and it was just kind of made my day. But the actual number is 15 years he hadn't eaten corn on the cob. So check this out. For Michael, he had a chance to come in. He was struggling with several different things. Not only he was missing some of his lower back teeth. So for him, we worked to preserve his front teeth on the bottom, but we placed some implants on the back lower so that he could still have all his natural teeth plus a little more added function. But then on the top, he had a denture, or he had to lose his teeth up there, and so he needed a denture. The complicating factor, though, is that he had a really bad gag reflex, and so he struggled. He couldn't even function with a normal denture. With dental implants, we actually can remove the coverage over the roof of the mouth that a denture has because they attach to implants instead of relying on that roof of the mouth for like a suction cup effect. And so for Michael, we were able to overcome his gag reflex and get him back to where he had almost ideal function, very shortly thereafter. And so he talks, I showed you the slide earlier where the patients have kind of collapsing facial features. So you'll see he even talks about people at church saying his face looks longer. So take a listen to what Michael has to say.
Now, the time for people to get the implants. It's the best thing that ever happened. Once you get over your gagging, which I did, and I found out from other people who have them, implants on the bottom especially, people tell me at church even that my face looks longer. I can chew a lot more than I used to be able to. I do thank you very much.
And then finally, Robert. I showed you Robert's case a little bit earlier where he was missing a broken front tooth, or had a broken front tooth. I want to highlight a couple things. One, he says the pain was very minimal, but for Robert, it wasn't even really a minimally invasive procedure because we had a broken tooth root that had to be removed. To me, that's kind of invasive. Yet, in his case, he came in, he's going to say I was a little nervous. The truth is he was very nervous, and we had to remove that tooth. We got it all done, but in his case, he was able to do it with no pain, or minimal is how he says it. And I'm also very proud of that. And so I want you to hear what Robert had to say and just take a look at how his smile turned out.
Hi, my name is Robert Kerstatter, and I came to New Horizons to get an implant on one of my front teeth that I knocked out in an accident. And I was worried that it was going to be very painful. I was a little nervous about it. The staff here made me feel comfortable. The pain was very minimal. It was a great experience. And once I got the implant done, I went ahead and had the rest of my front teeth, had crowns put in. And the whole experience took a little while, but the end results were fantastic, and I'm very happy.
As I mentioned before, I have a few gifts for you as an attendee of this webinar. I'm thankful for the opportunity to share with you. I hope you've been able to see this is a passion of mine, and I'm glad to be able to make information more readily available to you. So when you come in, that 3D scanning technology I want to make accessible to you. The truth is that once I have that, I have the ability to actually make real recommendations, and we're not guessing about what you might need. So that is my gift to you. I'm happy to do that for you. And I'll also, between myself and my assistants, I'll do a consult for you where you can get all the information you need from people who really do this every day. That's what we do. And we're happy to give that to you and give you that information. From there, if you choose to move forward with an implant, your first implant you can get at $990, which is quite a discount. We've actually reduced the price on all of our implants, and that is something that helps people to make things more affordable. If people need a bunch of implants, there's even further discounts, and certainly the people that partake as patients in my teaching work that I do, if you're willing to be part of that, it's not that you're a guinea pig, I'm doing the work, but you have an opportunity to, help me teach. You can get some great discounts on that too. So it's part of what we do. I think that the hidden, savings in dental implants is where, I do a lot of work where you might go someplace they've told you need to rebuild a bunch of bone, you might need to do sinus lifts, you might need to have a bunch of grafting done. And in the world that I live in with minimally invasive, a lot of times we have ways to not have to do those extra procedures. To me, those are the ones that a lot of times can be more costly, significantly more expensive surgeries. They take a lot more time to heal from, and they're more invasive, aka uncomfortable. And to me, that's stuff, if we can avoid it, let's avoid it. Let's save you that money and get you back functioning as quickly as possible. So those are all my gifts for attending. If you would like the information, in a virtual environment, just know that you can reach out to me, follow the prompts, click the link for the Smile virtual consult, or, come see me in person. And if you would just like to meet my team and meet us in person, you can also click to learn when our next implant dinner is, where we'll be out having an informational dinner, and you can meet us in person, ask questions, and talk about it. Before I conclude, I wanted to answer a couple of frequently asked questions, and I got a question in just a little bit ago. The question is, does dental insurance pay for dental implants? And quite commonly, we're finding that dental insurance is paying for it more and more. Now, implants, like I said, are the gold standard in dentistry, but they, for some reason, insurance companies have been slow to respond to that. And it turns out in many cases, you have to choose implant coverage when you elect your implant coverage. But my team has great ways to help you, reduce the cost by using your insurance savings as much as you can. Another question that I got was, how much is the total cost if you can get an implant for $990? So for a single tooth replacement, you've got to expect that your total cost, depending on where it is in the mouth, in the front of the mouth, it's a little bit more because we have to do more customized work, a customized abutment. In the posterior, we can use more a standard form for a lot of things. But on the low end, you're probably going to be spending somewhere around $2,500 in total. That doesn't necessarily include taking teeth out and any grafting and things like that. It includes basically your implant, abutment, and crown. For a single tooth in the front, it could be closer to, $3,500, $4,000, depending on where that goes. For those options like the implant bridges, you may spend, I would say somewhere in the, could be 5 or 6 or 7,000, depending on the span of the bridge. For the ones where we're talking about dentures and implants in combo with each other, a lot of times that's somewhere in the 7,000 to 9,000, per set. So it just kind of gives you an idea where you land with all of that. And then I guess the last thing is, just know that when you come to see me, you're going to get your questions answered, and that, we're whether it means if somebody's going to lose all their teeth and we're going to go through that journey together, just know that that's what we do. And we really work to make that easy for you. Every step of the way, you'll know what's happening, what's next, and all of that. So anything that we undertake, we're going to always make sure you're informed, you're comfortable, and that we handle the process so that it makes your life as unaffected as it possibly can be. So please click to come see us or schedule an appointment or virtual consult with me or come to our next implant dinner. Know that we've got some free gifts for you. And from, my team and I want to express so much gratitude for you taking the time to get educated about this. And I hope that in some way it helps you know what you want to do or not do, and, come away without a minimum more information than you had at the beginning, so that you can just make a healthy, informed decision. I look forward to meeting you in person and talking to you soon.